Your overhead should be somewhere around 55 to 60%. So all of your expenses, so when you're up on QuickBooks and you understand your profit and loss statement and you're looking at all the numbers, your total overhead, everything you're spending in the practice, staff salaries and marketing and supplies and all your fixed expenses like rent and the facility management, all of that should add up to 56% of your collections. The more you earn, the lower your overhead percentage will be, because you don't always need to add costs to earn more. So if you're on a lower number and you have a higher percentage of overhead right now, that may just be a top line question more than a bottom line question. The doctor really should take home the rest, 40 to 45%. And the way we recommend you think about that, and we talk a lot about this in the 4th session of our training university, it's dedicated to wealth mastery. We help not just the doctor master wealth, but we help the whole staff get really masters at wealth. And so one of the things we recommend is take 10% of that and invest it back into the practice. Keep up with the latest technology. As I talked about before, technology is a great marketing tool as well, and it helps you do your job better. So take 10%, keep your practice up to date. Patients want to see up-to-date practices. And then take 10% and put it away. Pay yourself first, as the guys at Fidelity would say. Pay yourself first. Put some away for your retirement. And keep 6 to 12 months in a rainy day fund so that for an emergency, you'll need that as well. And you will earn the power of compounding interest, which we talk about as well in the Wealth Mastery program, is really amazing when you start to put some of this away at a pretty significant clip for retirement. Just as a quick way to illustrate that, if you're 20 years old and you put just $2,000 away every year for 6 years, so from age 20 to 26, and then you let that grow at an average clip of 10%, that is probably a little high these days, but for illustration purposes, 10%, and that person retires at 65, how much will they have? Who wants to make a guess? So $2,000 a year for 6 years, it sat around for 39 more years. How much are they going to have? Do you want to hazard a guess? 150,000? Anyone else? 10% compound interest, $1 million is the answer. Now let's take another person who starts at age 27, after this other person started, and invest $2,000 a year every year until age 65. How much do you think they'll have? Also $1 million. Also $1 million. So I'm not here to make you feel bad because you didn't start at 20. The point is, start now. The best time to plant a tree is 25 years ago, and the second best time to plant a tree is today. So start putting away, and you've got the capacity to do that. You've got the capacity to do that. So this is where your numbers should be in $1 million practice for sure, and even in any of those other levels that I showed in the previous slide. Yeah, so your student loans, you want to pay, so what takes precedence is really your question. And the question was about, what about my student loans? I would say if you're paying interest on loans, pay down the debt. Pay down the debt and put away. And that depends also on the interest rate. If you think you can earn more by investing it than you're paying on the debt, any type of debt for that matter, then you may want some combination.